Do you suffer from high blood pressure? 50% chance says you do, because it's the #1 cause of death in the United States. It is the #1 medicated disease in all of America. Listen, I'm Dr. Ben, founder of Well Health and Chiropractic, and I want to tell you about the solution, the proven method. I've seen over 2,000 people take their blood pressure medication and chuck it in the trash can. No medications, no surgeries. So many people are told that their blood pressure is genetic, or their dad's got high blood pressure, or even maybe that it's a weight issue. Listen, I get it that those are all predisposing factors, but there is a #1 thing that is so much more important than all of that, and that is the nerve, because no one is talking about it. So the brainstem and spinal cord controls every organ, cell, tissue in the body. For your heart to beat one time, the message has to go from the brain, down the spinal cord, out the nerve to the heart, right? And that's how your body is designed. The problem is, if we were to cut the nerve to the heart, what happens to you? Well, you die, right? But what if you don't believe that, by the way? It doesn't matter. Turns out you're dead and you're wrong. Right? So rather than cut the nerve, what if we were to pinch the nerve, right? If we were to put a pinch on that nerve, now what happens to the function of your heart? Well, it's not going to function correctly. So what's your blood pressure going to do? It's going to go up. What's your plaque and your cholesterol do? It goes up. Eventually your blood gets thick. The doctor puts in a blood thinner, even though all of those medications are not preventing heart disease. It's the #1 cause of death, and in spite of the medications we're taking, heart disease is not getting better in the United States. So what is the real problem here? The problem is this is a chiropractic problem with a chiropractic solution. Right? Some people say, by the way, chiropractor, I never believe in chiropractic. Guess what? It's not a belief. Chiropractic is simply a tool. It's a tool to move a vertebra, to unpinch a nerve. Let me explain to you how it works. The way that these nerves get pinched, and that I see in my practice, which I've seen, again, 2,000 people take their blood pressure medication, chuck them in the trash, is the #1 thing that we see is people with whiplash have blood pressure issues. Again, that's anybody who's ever had sports injuries, wrecked their bike, car accidents. If you've ever had a car accident, you definitely have whiplash. Maybe you're sitting over a computer like this all day long. What happens is this is your vertebra, this is your spine from the side. It's supposed to have this nice normal curve, and your spinal cord runs back here. Okay? Well, when you have a whiplash, your neck gets very straight, and what happens is we wind up pinching these nerves in the lower part of the neck. Now, those are the nerves down here that go to the heart. And when these nerves get pinched, right, it's going to cause blood pressure issues. Okay? So the problem here is that the nerve is pinched. The solution is that we need to move the vertebra to unpinch the nerve, but it's just not that simple. Because when you have a whiplash, you wind up damaging that ligament. Okay? You damage the ligament and you wind up pinching the nerve going to the heart. So what we have to do is not only adjust your vertebra, but we have to work on the muscles, ligaments, and tendons to get that vertebra to stay in the right position. Only when you can get it to stay will you see the blood pressure change. Now, I'm going to tell you right now, what we do in this office is full corrective chiropractic. It's very unique and it is different. If you have ever been adjusted before, if you've never been adjusted before, we are for you. How our process works, you come into the office, we do an exam consultation, and we do a full set of digital x-rays. That lets us know any past whiplashes, any arthritis. I will be able to tell you whether I can help you or not. If you have a pinched nerve of your heart, we can help. If you don't, I can't, and I'll tell you. Of course, in the fourth part of our intake process is we then do a treatment. That first treatment is an adjustment that allows us to move the vertebra very gently and safely and start to train the muscles, ligaments, and tendons to get it to stay. Listen, if this is you, and I'm talking about you right now, and you're thinking, man, I've got blood pressure, I've had whiplash, I wonder if I need to be adjusted. I've got a deal for you. Normally, that whole intake process is $397. I've opened up 10 spots that we're going to do $21 full initial process. Again, that's exam, consult, those full digital x-rays, and a first treatment, all for $21. But you have to click below. You have to do it right now. There's only 10 spots. They're probably going to be gone in the next few hours. You need to click below and get your spot. The reason that I'm doing this is it's real simple, is that I know that if I can get you in the door, get you results, you're going to be a customer for life. But not only that, you're going to be referring in friends and family, anybody else who's got blood pressure, so that we can fix that naturally, no drugs, no surgeries. Listen, I really encourage you, right now is the time, click below. It's 21 bucks, what have you got to lose? And we can get you in, get you checked out, and hopefully get you well ASAP. Guys, I'm Dr. Ben. I look forward to seeing you soon.